I'm Kate Czaplinski for the HAN Network. September is National Pain Awareness Month, and we're here at Silver Hill Hospital in New Canaan talking to the experts, talking today about chronic pain and its link to depression. I'm joined in that conversation by Dr. Chris Cutter, who is the program director at the Chronic Pain Recovery Center at Silver Hill. Dr. Cutter, so happy to have you.
Thanks for having me.
Now, first, talk a little bit about what is chronic pain. Can you define it for us?
Sure. So, in essence, it's suffering. And then we think about pain itself being a sensory and emotional experience that is either real or perceived to the body. But when we think about chronic pain, it's that type of pain lasting 12 weeks or longer. So the way I like to explain it to my patients or the family members thereof is that think about having a smoke alarm in your house. And so it's going off and, there's smoke. Great. It warns me that there's potential danger, might be fire. But so imagine that smoke alarm keeps going on and on and on. And there's just no smoke, there's no fire, and there's really no reason why this thing is still alarming everyone. So it becomes this really strange signal that then we're talking about pain again, like a pain signal keeps firing over and over, even though all the healing is possibly done to an injury. And we really don't know why it keeps firing like this, as there's possible nerve damage that just lingers. And again, it comes down to this boiling point of they suffer through this endlessly.
And now, how widespread is this problem?
Good question. So we have approximately 100 million Americans suffering from this. And coincidentally, we have billions of money going into the treatment of this. And it's kind of this new emerging field where not many people know how to treat it specifically. And what we'll kind of get into further with the line of questions is the more and more we try to treat it with medications, since we have people kind of going into the ERs saying that, oh, I have a lot of pain, and folks are quite confused why there's so much pain and trying to go to certain experts. Unless you're just starting to go to a chronic pain treatment facility, it's tended to be treated in a short-term fashion, such as a medication. Whereas the only way the technology where we have it right now to treat pain is we have to learn how to manage the pain rather than get rid of the pain. So say this chronic pain is lasting 12 weeks or longer. The pain might be an 8 or a 9, something rather terrible. In order to manage the pain, we learn how to manage in many different levels. You want to get that signal from 9, maybe down to a 5 or a 4, so you can still experience your life and have the quality of life you want. To get rid of it entirely might be unrealistic.
Now let's talk about quality of life and just kind of the impact this could have on somebody's life. What is the link to depression when somebody suffers from chronic pain?
Good question. So we see a lot of different folks come in through our recovery program over here. So people would come over here with existing depression, and they would have this unfortunate chronic pain on top of it. And then we have folks that would have chronic pain, and then they would start having these depressive symptoms. And they would basically exhibit the same exact clinical profile between both patients. They would have isolating behaviors, really just different moods of being a little bit labile, aggressive, really grumpy, really sad, but also feeling quite hopeless. So we think about the suffering from chronic pain, that these folks have this sense of hopelessness that this pain will never end. It would bring any of us down to feeling quite low. So it's this huge association that we see most of the people that come in to the Chronic Pain Recovery Center, even some of the research I'm doing at Yale, we just see depressive symptoms coming in with almost every single patient. And then one thing I tend to notice, which probably we can talk about in a little bit, is we start noticing folks tend to become more and more sedentary the more they have pain. And so normally when we do have pain, the good response that we would have is to rest and lay down, take it easy, and that's actually a really good prescription to, when you have an injury, if you break an ankle, lay off the ankle. But if you have chronic pain, eventually after that ankle has healed and the pain's still firing, you really need to start moving on it. So the more and more sedentary you become, the less and less active you become. And then we start noticing, even with the depression research, the less active you are, the more depressed and more mood problems you start having.
Yeah, let's talk a little bit about that. I mean, we know exercise releases endorphins. It can help people. Is that why it's so important maybe in treating chronic pain?
That's definitely one aspect, especially for the mood part. So we're looking for the exercise to release your endogenous endorphins, so the morphine within, if you will. So it will help, but we have to take a look at how to carefully regiment an exercise plan for our chronic pain patients. So we want them to get more strength and more flexibility to surrounding muscles of an area. Say it's a non-specific lower back pain. So if the pain has a lot of injuries and we have a lot of nerves being damaged or discs being damaged, we want all the surrounding muscles to be strong. So we want the core to be strong. This is just an example. There could be pain in different areas of the body. So we would like the abdominals, lower back, chest to be stronger so it could help carry the weight of the injured area. Releasing the endorphins within, that would be a really great segue to talk about mood as well. Thinking how the more and more physical exercise you get, the more body feels like it's receiving a sense of accomplishment. But it also, when it gets to extent, when we feel that type of runner's high, it can release endorphins. The trick is, a lot of our patients are on opiates, and that actually limits the ability for the body to produce its natural endorphins. So it takes quite a while to start experience that natural runner's high, but we do notice after time they do get it back, but it just takes quite a bit of persistence. It's not a short fix. This is the marathon fix.
Now, let's talk a little bit about family members. How do they typically react when a loved one suffers from chronic pain?
So we see a lot of different ways of how people react with that. So one is they're really caring. They really like to try to help the family member. They feel quite bad. It's usually when an injury happens. And they understand that their family member, their loved ones, are suffering. Eventually, after a while, they get really tired of hearing it and they get really bored. And eventually it just becomes this white noise in the background. And some family members believe they are faking it. Since there's really no way to track chronic pain, we can't really measure pain receptor firing that accurately. We usually have to just take their word for it. And when we do see people suffering over and over again, they just stop. The family members tend to start withdrawing and stop trusting other family members. So in the beginning, so it's for the most part, I'm not saying for all patients, they tend to, in the beginning, be supportive. A few months later, it's really taxing on the family. It's taxing on every member. Actually, I think I'd like to go into, if it's okay with you, to kind of go, what would be helpful? Please. Okay. So we think about the lifestyle change that this family member has to engage in. And so we think how family members can be useful when they agree, yes, it's chronic pain. So let me see, let me try to be more supportive of you. We think about this as a chronic pain as a debilitating chronic disease such as diabetes or hypertension, where it takes the entire lifestyle to treat this. So we take a look at physical, social, emotional, and spiritual. Spiritual, if that is a component of strength for a patient, it might not be for all patients. But when we take a look at the social component, how they're going to change their life, we try to get the family involved to just get the patients to become much more active, to be supportive of them, and to recognize where the limits, where the patient can go. So a lot of this is getting out of the zone of comfort. So there's a comfort zone that when anybody has pain, they don't want to go past a certain threshold. It's good to try to push yourself a little bit past it and have family members really recognize and understand once the threshold has been passed, it's time to break. It's time to start pacing themselves.
Well, Dr. Cutter, any other things that you suggest to family members just when approaching someone in their life that suffers from chronic pain?
Yes. So when somebody is having chronic pain, this is actually one of the more important ways to address it. To know sometimes you're talking to the patient and they're being themselves, they're being the person that you care about and love, but sometimes the pain can have a personality of itself. And so we tend to talk about over here is you have your pain personality emerging, and where the person might not realize how they may be reacting and behaving toward others in society and their family members themselves. To understand there's a great deal of patience that comes in with trying to first address somebody while they're in pain, and know if they need space, they need a break, and they need to come back to them at a different time. And then when they want to go through it, how to help support them. So what can I do to get you through this? Do you need to take some space? Maybe and kind of recognize the pain behaviors they exhibit, such as grimacing, possibly tearing up. Knowing when to let the patient know they don't have to be a hero to take a break. It's like, now let's take a break. It's time to pace ourselves without trying to infantilize them. There's a lot of dignity that is at stake here. Mm-hmm.
Really great advice. And Dr. Cutter, just so appreciate all the work you're doing here at the Pain Recovery Center.
Oh, yeah, I'm happy to be here. We started running the program in a new direction a couple months ago, so we're pretty excited about the new programming coming in. And well, thanks so much for speaking with me.
Thank you so much. All right, well, you can find out more about our partnership this month with Silver Hill Hospital at HAN.network.